got 6 p.m. We got some folks online. Tonight, we're very happy to have, I'm just going to say Aleksey and Michael. I'm going to Lavrenenko and Mike Robinson. Okay, I don't think I just
got it.
Thanks. We're really here at Gears. We're very excited because this is an often unlooked at side of just getting into cycling and just actually maintaining a long cycling life. Just knowing that there's professionals out there that can keep you comfortable on your bike, not just comfortable, but also keeping you even, if my own experience with physical therapists from cycling is any notion, not only just comfortable, but can optimize your cycling and can make you stronger and can make you cycling correctly for your own specific anatomy. Just a quick note about Gears, what we're doing with our educational series. We're trying to do one a month. We're very excited to have these guys this month, and in a month from now, we're going to be doing a women's only climbing workshop on the 23rd of May. And please spread the word. It's going to be a great class. We have 2 great athletes out of Salem, actually, Jamie Lusk and Sarah Fischler-Rice, who are going to be teaching it. So we're excited about that. And given that, we're at 6:02. I don't want to take any of your time, so I'll let you take it from here. Thanks, you guys.
All right, Mike, you got the presentation queued up on here, right?
Yeah,
I'm
I'll
switch
bring it up
spots
for you. Yeah, we'll do a little do-si-do here.
You can tell the height difference between the two of us here.
My window here, if I may. Yeah. We got some pictures we want to show with you guys along with our talk today. I think it'll just make it a little bit more interactive too. And we've got a couple cameras going, so it'll be kind of nice here. We'll just cue this up here.
And the way we got our setup, while one person's talking, I'll be kind of looking at the chat too. So if somebody has a question at any point you guys want to ask one of us, let me know. Just type it into the chat, and then I'll make sure it gets addressed too.
Awesome. Cool. I'll let you kind of start with your spiel so far. Yeah.
So we just wanted to start out with some introductions first. My name is Aleksey Lavrenenko. I'm a physical therapist over at Therapeutic Associates in downtown Eugene. So we're located on Charnelton and 8th. And my background is I grew up riding bikes my whole life. I've worked at a bicycle shop from the age of 15 to 23. And I went to PT school. It's kind of a natural thing to marry those two things together for me. I've been through some bike fit certification courses before PT school, and now again since after PT school. And I do bike fits for primarily road cyclists, but we can do a lot for mountain bikers too. There's just a little bit less adjustments that we have to make. But again, it depends on the caliber, the degree of what you're riding, and how you're using that bike in general. Went to school at Ohio University, actually with Mike, and now living out here in Oregon and tearing up the mountain bike trails between Oak Ridge, Alsea Falls, and Bend. So I'll turn it over to Mike.
Awesome. Yeah. Michael Robinson, physical therapist at Cooperative Performance and Rehabilitation. We're in South Eugene here. I spent the past year going over a cycling performance rehabilitation program for our clinic and just developing that. And then coming up soon here, we're starting a performance enhancement program as well. So I dove really deep into the research, took some continuing education courses over the past years to really build that knowledge up and really help deliver a program that's good for our clinical patients. And then coming up here, we'll have something that's going to be really great for performance enhancement as well too. So we're super excited for it. So just keep an ear to the ground as we keep opening things up too for performance enhancement as we go along too. So we're super pumped about it for sure. So
yeah, and Richard's asking us a question, is wondering if insurance pays for bike fits. We'll get into it a little bit further,
yeah,
but bike fits and rehab can be billed under insurance as long as it's associated with some sort of pain that we're rehabilitating from. Both of our clinics have cash pay options for this kind of thing if you guys are looking for just the fit, or if you're coming into your PT clinic and you're getting some sort of hip pain, knee pain, whatever that's being addressed, and the bike cycling is related to that injury, meaning you have difficulty riding your bike or anything that can be attached to that, we can absolutely bill it through your insurance. That shouldn't be a problem at all.
Yeah, absolutely. Sometimes I think about it as like, if you go for a ride and you have, say, knee pain, and then that knee pain carries over to the rest of your life and starts bothering you while you're, say, taking out the trash, going to work, it bothers you throughout the rest of your life, then that's something that's more insurance-based, that we would say that's taking a look at their ADLs, their activities of daily living, and things that are bothering them throughout the day. So that would be more of a insurance case there. Cool. Sure. Awesome. I can take that first.
Sure. Yeah. I'll take the first one. So we just want to kind of give you guys a little bit of a background on what PT really even is. I know a lot of you guys have probably been to physical therapy, but sometimes we have a little bit of a misrepresentation in the public eye. Some people think that we're just glorified personal trainers. And so to go to PT school, we had to go get our doctorate. And we had to learn a lot about how the human body moves, everything we can learn about the anatomy, and a lot of pathophysiology, disease process, and all of that. So we are licensed healthcare providers that do integrate medical knowledge into rehabilitation through exercise, manual therapy, whatever interventions we choose that will be appropriate for you getting back to normal. So our goal is to just take a look and see and evaluate how you move, integrate that with any sort of health conditions you've had in the past, previous injuries, and build a plan for how to get you back to your goals. We help improve pain, restore function of movement, lessen any sort of symptoms of many chronic conditions too. There's a lot of things that we can help you work around. You know, some people have things that aren't going to change necessarily, and we can figure out whether it's through a bike fit or the way that the rest of your body moves, how you can still enjoy the things you want to enjoy. And one thing that Mike and I are both proud of in our clinics is we do provide a lot of one-on-one care. I know our profession has had some clinics where you kind of just get pawned off and you're just thrown on a machine and, you know, things go that way. And one thing that we can both proudly say is that we are both involved in a lot of hands-on treatments for physical therapy, rehabilitation, and our bike fits, and that we can dedicate an appropriate amount of time to help people get better. So there's not a ultimate rush to get people in and out the door.
Absolutely. I think one of the coolest things is that for physical therapy, we are licensed healthcare providers. So some people really don't think about that too much. So not too many years ago, it was the American College of Sports Medicine. They had a huge advertising campaign where they're putting out that exercise is medicine for people too. So there's a lot of conditions more and more that physical therapy is the first line of treatment for folks, especially with low back pain too, that physical therapy is more and more the medical treatment prescribed for that too. So it's kind of one of the cool things about it from our profession, and one of the reasons we love it so much too. Cool. So we wanted to go over just how physical therapy works for folks. So typically, whenever you see your doctor or you just know a physical therapist in town, you just schedule a visit with them. You can do that with or without a referral, and that really just depends on your insurance. So some folks might need to see their physician first, get a referral for whatever body part they're experiencing a dysfunction or pain in. Some folks have the ability just to come right to us, and that's really just one thing on an insurance basis. When you come in that first day, we call that an initial evaluation. So what we do on that first day is some movement analysis. We establish the patient's goals, not just relieving pain in that joint or area of dysfunction, but what do they want to get out of it? Because sometimes it's not obvious just from looking at someone. We'll go through some range of motion and strength testing with them. Likely that day, you're going to get some hands-on treatment session. That's a lot of what Aleksey and I do when we're practicing, is that manual therapy or the hands-on treatment really comes in really well for acute treatments. And then we'll get started on a home exercise program, especially that day, so that when you leave the clinic that day, you have some exercises to take home. That is like a prescriptive exercise program too. So that's exactly for that joint. Sometimes I tell my patients that's exactly what you want to think about is the same as taking a prescriptive medication too, because it will have dosages on there too, how often and how much you should do that exercise. After that initial evaluation, you should have a follow-up within that next week, hopefully, so that that physical therapist can reassess you at each visit, continue whatever hands-on treatments need to be done, progress those exercises, and just touch base to make sure that you're progressing as soon as possible too. The ultimate goal with all of our physical therapy treatments is to give you control so that when, say, any type of the pain or dysfunction comes back, you have tools in your toolbox that you can just take out. It's like, oh, I remember I was working with Aleksey. He gave me this stretch for my shoulder or my knee that I really need to do. That was really helpful. I should pull that out again too.
Yeah, and I just wanted to also touch base. We're going to use the term manual therapy. It's just a common term that we talk about all the time in PT. But manual therapy can be a number of different things. It's just any of the hands-on treatments. So we're trained in a lot of joint mobilizations and manipulations, much like chiropractors are. We're trained in soft tissue mobilization, like massage therapists are. We do things like scraping, if some people may have heard it called Graston or A-stim, cupping, a variety of those interventions. Those are all considered manual therapy under the umbrella of physical therapy. And Mike and I have had pretty extensive training in quite a bit of those things. So that's whenever we continue to use that term down the road, I just want to make sure everybody's aware of what we're talking about.
Absolutely.
So I wanted to use this slide to kind of break up and distinguish between traumatic and non-traumatic injuries, because I think a lot of times we think about biking related injuries and that has to be a crash, and it's not always the case. Traumatic injuries, are things where you have hit that joint, that tissue somehow up against something, or another extremely common one, especially in our world, is concussion. So a lot of people don't realize that physical therapists do treat concussions too. And Mike's clinic, especially, they specialize in that. They have a lot of equipment here. They have a lot of protocols that are aimed specifically at getting people back from concussions, whether that be even tolerating bright lights, reading, whatever that may be, whether it was even a bike related injury. And then, like I said, direct injuries are things like fractures, soft tissue, inflammation, or anything like that. Non-traumatic injuries are things like overuse injuries, things like postural issues from improper bike fits. We listed the most common ones, and we'll delve into them a little bit as we go through our presentation, but by no means are we limited to these things. But by far, the most common thing that bike riders experience is knee pain. The most common pain that we deal with as a nation is low back pain. And then again, I guess the second most common bike-related thing is neck pain, or some sort of hand-related or neck-related hand numbness, tingling, etc. So.
Absolutely. Cool. Like Aleksey was saying, low back pain is the most common injury, and it just has multiple causes as well. So I love the statistic. So 25% of the people in the United States have reported having low back pain in the last 3 months. And Aleksey and I were talking at last weekend as we we're talking about this presentation, and that includes both of us too. So there's probably people in this presentation or in this talk right now are thinking, oh yeah, that's me for sure. Low back pain can be something that's really simple, that can do what we call spontaneous resolution. It can go away within 2 to 3 days, or it can hang on for multiple years too. It can be really serious. It can refer pain down the legs. It can cause numbness and tingling. It can happen to us while we're riding a bike. It can happen to us just lifting a box. So these things are really good to follow up with a physical therapist for, especially if you find your low back pain reoccurring or just not going away too. The ideal treatment for low back pain is first getting some screening for some serious pathologies. And that way, you can rule out some really bad things that could happen for people when they do have low back pain, and then fall into a physical therapy category where that treatment would consist of, just generally speaking, we like a mantra for that treatment. we tell people you want a stable spine, a strong and mobile hip. So any low back pain treatment you do, no matter what the cause is, that's what you're going to be looking for. The stable spine really emphasizes core strength and movement awareness. The strong and mobile hip goes through how the flexibility training will really help people, and then the strength in the hip. Generally speaking, moving through the hip, keeping the spine really stable is really helpful for everyone in general, preventing low back pain, and even with people with low back pain. Generally speaking, too, when you see a physical therapist, they will work with you for activity modification, some movement training, core strengthening, like I mentioned earlier. There's that manual therapy term again, and then range of motion as well. So physical therapists are really stepping out to being in the forefront of treatment for low back pain, which is really good. As most people know, we had a really poor history in the medical field with opioid addiction, and we're still dealing with our past with that. And that was a lot from some low back pain treatments previously too. Yeah.
And the activity modification thing too, that we can help people learn the things that are harmful for their backs. Sometimes you may not even know it. Sometimes that involves resizing a bike. Sometimes that involves us telling you how to change your training routine. Sometimes that involves a number of things, but the goals are that we establish what's bad for your back, what's good for your back. We help you get out of your body's own way of healing sometimes. So moving on to neck pain. So I'm sure most people on this call have had neck pain from riding their bike before, and things that they've dealt with either from just being on the bike for too long or having an improper fit. We know that being positioned in the cockpit of a bike puts a lot of compressive load on that neck. So when we're kind of in this position, there's just no way about it. It's kind of uncomfortable. That progressive load can be tolerated for a short period of time. But when we're increasing our riding volumes, meaning training more than we did before, or actually going from a period of not training. So right now, everybody's getting into their season. This is when we start to see a flood of people getting injured for a number of reasons, whether they're riders, runners, gardeners, anybody. They're going from sitting a lot, in the rainy season to getting back outside and doing what they love. So increasing volumes of anything after a period of doing very little oftentimes causes some issues. So we can help with that kind of thing. One of my favorite mantras that I learned from a PT is a majority of injuries happen after doing too much too fast, after doing too little for too long.
Yeah.
And that rings so true in our world. But we also know that neck pain can refer up or down the chain. So if we're in that position for a long time, muscles get tight, they can compress on nerves, blood vessels, and all these things that can radiate pain up the head, causing migraines, headaches. They can compress nerves that go down the arms and cause radiating pain into the shoulder, elbow, forearm, numbness and tingling in the hands. That's such a common thing that we hear cyclists complain about. Another common thing that we get is we're always forward hunched, whether we're at our desk, at our computer, at school, at work, wherever we may be. So we get a really stiff upper spine, which when we're on a bike puts us in this position that requires us to have to hinge a lot through our neck. So that's a really, really common thing that we start to look at for anybody who is dealing with that neck pain. And a lot of times a poor bike fit does contribute to this. You have too short of a stem, or you have the wrong size frame, or sometimes it's just your posture on that bike. But we can kind of take a look at all those things and be able to address it from a lot of different variables. Another thing, being in that cockpit, and if we have weak shoulder stabilizers, we kind of fall through and we rely a lot on the ligaments of the spine, the shoulder, the neck. All of these things feed into neck pain, shoulder pain, arm pain. And again, that same mantra we used on the last slide, PT can help you with modifying the activity and kind of getting out of your body's own way and letting things heal. Making sure that we're not putting unnecessary stresses onto the injured tissues. We can retrain how you move. Again, just cueing people up sometimes to say, when you're in this position, you should be engaging the appropriate muscle down underneath this armpit to hold your shoulder blades in place. All of this kind of stuff can help you get back to riding with less and less pain. Of course, core strengthening is important because your contact points on a bike are the handlebars, the seat, and the pedals. So your core basically connects your lower body to your upper body. If we have a big disconnect there, that can translate to pain in both directions, down the legs, in the knees, in the back, or even up and towards the neck.
Nice. We've got a really good question, actually. So this is from Susan. She's asking, thanks, Susan, for the question, by the way. What are shoulder stabilizers? Can we be a little bit more specific in those muscles? So this is a really good question because there's a lot of shoulder stabilizers, and it always depends on the activity that we're doing too. So generally speaking, some of the shoulder stabilizers, we could name all the rotator cuff muscles. What Aleksey is really pointing to here is this muscle right underneath our shoulder here. It's called our serratus anterior. So when people are on their handlebars on a bike, what they'll do is they'll retract. It's a technical term where their shoulder blades will go backwards into this position and they'll kind of scoop together. And so this puts a lot of stress on our ligaments of our cervical spine, the ligaments of our shoulders. And that's why some people will have some pain following a prolonged amount of time in that position. What's the solution is to get these muscles that everyone has to turn on and push up a little bit more into this motion we call protraction. And then once we get into that position, all of that body weight load that was on our hands and our shoulders gets transferred to this dynamic muscle, the serratus anterior. And then that load is all hanging on that muscle rather than being on our joints, on our ligaments. And that's how you see someone go from an area of pain to no pain too. They'll just say afterwards, I'm a little bit tired under here. So.
And that's just, it's not a catch-all solution to things. We're just kind of naming off some common things that we find ourselves repeating time and time again to a lot of cyclists. But that may be the problem, but it may not be. And that's why we love the first day. The first day is, to me, the most exciting day when we do that new evaluation, because we sit down, we talk about what's going on, and then we check out and see how are you on the bike, what kinds of parts of your body are either restricted in ranges of motion in all these directions that are necessary, which body parts are weak and what do we need to strengthen, or where is there a mobility, joint mobility. So we talk about range of motion. Range of motion can be affected by tight muscle somewhere that's not letting you go up, like something down here, or it could be restricted by a shoulder mobility issue, which needs a little bit more of a hands-on mobilization task to help loosen that up. So we do a series of tests on day one, and we keep coming back to those tests on subsequent days to make sure that we're addressing the right things, not just giving you a cookie cutter, approach to say everybody with neck pain on a bike should do this, because that rarely works.
Yeah, absolutely. Hopefully that answers your question, Susan. Let us know a follow-up question if you have anything. Again, really good one. Cool. Awesome. So we're going to talk a little bit more about knee pain next. So according to a lot of the literature, this is the most common cycling injury. So if you've been in a cafe or hanging out with people after a cycling ride and everyone's kind of hobbling because of their knee, that's correct. It's the most common one. So our knee gets a lot of repetitive use during cycling. And this is really just due if the alignment of our knee isn't optimal or our muscle control is lacking, that our knee gets this opening and closing. We call it flexion and extension, repetitive movement that can lead to be detrimental. We always tell people here that our knee is really like a door hinge. It opens and closes. It isn't meant to go inside, outside as much. That really stresses some of the joint structures in there and can cause a lot more pain. Some common causes of knee pain, some of these you might be familiar with, are osteoarthritis, IT band syndrome, something called patellofemoral pain, patellar tendinopathy, and hamstring tendonitis. So some of those last four, the IT band and all those others, those are a lot of overload injuries or too much load on the knee joint. So those really occur if there's any problems with our form or how we're cycling to cause one area of our body to accept all of this load, and then the tissues there can become really irritated. Osteoarthritis, this is one thing that just comes up as all of us get older. So commonly, like if someone gets an x-ray, they'll see this as sclerosing, which is these white lines that come up on our x-ray, this decreased joint space in our joint, and then these things called bone spurs or osteophytes start to show up too. So though osteoarthritis, if you're having that with your cycling, really what you need is some exercises to start getting started on that, and to find out if we're just putting too much load on that knee as well. Common treatments for the knee will include a lot of manual therapy, stretching activities, hamstring and hip flexor stretching, stretching that hip out in general. The bike fit can really help if you're just putting too much load on one side. Getting that core stronger, that's something we commonly talk about, and just modifying how we're doing our cycling too. Sometimes doing flats versus hills can really make a big difference too.
Hey, Mike, we got a question from Mel. Mel's asking, at the age of 79, how do I distinguish between pain from cycling versus arthritis?
Oh, this is awesome. Okay, so I love this question because there's this old, I don't know, lore thing in cycling where it's just, we're cyclists. We're really supposed to endure lots of pain, We're going up a hill, it's gonna hurt. You just gotta grit through it, So really the thing is if you have burning pain in the middle part of your muscles, so think if you pointed to the middle part of your bicep, the middle part of your quad, if you're having burning pain in those, okay, that's really good. That's the exercise type pain that we're looking for. If you have knee pain that's inside the joint, so if you poke kind of the bony areas where your two bones come together and you're like, I'm getting it right in between there, that's the time where you really want to take a look and maybe schedule a visit with a physical therapist, or even a screen, which we'll talk about a little bit later if you have more questions on that, to determine if that's arthritis, is that IT band syndrome, is it one of these other knee conditions that I might be having, to distinguish between those really.
And arthritis, and it's asking if your pain is from arthritis versus from cycling. Arthritis is often aggravated by cycling too. Mm-hmm. So it's the answer is most likely both. But arthritic joints, they do really well with repeated motions. And I know some of you guys are like, oh, wait until you get arthritis. But but repetitive cyclical motions actually help the joint imbibe fluid, which basically is just saying it helps lubricate that joint. So if we can put someone in a position where they're frequently moving that joint under some compressive load, but not too much, we can actually decrease some of the effects of arthritis. Mm-hmm. As physical therapists, we are not surgeons. We can't go in there. We can't shave off arthritis. We can't reverse arthritis. For the most part, arthritis is somewhat of a permanent change to the joint. But there is a lot that we can do in helping you get the most out of that joint and decrease your pain. So if you have an arthritic knee or hip or whatever joint it may be that's affected by your cycling, we can make sure that your bike fit is right. So you're loading that joint appropriately so that we're not causing more excessive wear and tear. That's only going to set you back further. That is our world. That is where we live.
Yeah, absolutely. Absolutely.
Good question, Mel.
Absolutely.
All right. So the last slide is a little bit of a catch-all slide, but overuse injuries are what we're going to just touch on here. And we've mentioned some of these in one of the other slides too. Most of the time, overuse injuries affect tendons. We do get a lot of tendinitises. You guys have heard of things like jumper's knee, or Achilles tendonitis is probably the most common one that people know. Yeah. And a tendinitis is an overuse injury. So again, like I said earlier, doing too much too fast after doing too little for too long. Early in most seasons, we see a lot of runners and cyclists with either one of these tendon injuries, hamstrings, overusing a muscle. These can be because a muscle is deconditioned or not ready for that amount of use and abuse, or it could be because another part of your body is because that muscle is compensating for another muscle that is weak somewhere else in that body. So a lot of times if we have some sort of glute weakness, we can be overusing our hamstrings because there's a lot of redundancy within the body. So as one thing starts to weaken, we can still get through our days and our regular function by using something else. But when we exceed the capacity of that tissue, we start to break down and we start to get these overuse injuries. They're not exclusive to just muscles and tendons. They could also be occurring in the joints. So again, improper alignment of the joints can lead to accelerated wear and tear of those joints. So coming back to that arthritic joint, if the knee isn't well aligned while you're riding, it's going to get a lot of that overdue stress either on the inside of the knee, on the outside of the knee, or how that kneecap tracks. One thing that Mike and I do as part of our bike fit is we look at how is the cleat positioned on the shoe and how that affects your foot, ankle, and hip alignment. So Mike and I use a videotape process where we use an iPad. We can draw a line on that iPad or use a vertical laser that we line up with with a couple placements, a couple markers that we place onto the toe, the knee, and the hip, and just see how does your cleat position affect the alignment of those joints. Again, so we can minimize unnecessary wear and tear.
Absolutely. Can we go over real quick for him too, the differences between itis and apathies as far as the tendons too?
Sure.
So for an itis, a lot of times this is the acute inflammation of a tendon, especially. So the apathy is this general term they've developed in the research to describe the itis and this other term, the osis. So the apathy, tendinopathy covers both of those. The osis is when you've had a tendinitis for a really long time. It's no longer in that acute inflammatory phase. It's now going to this degenerative process where it's been irritated and inflamed for a very long time, sometimes over 14 days up until months now at this point. And so a lot of times people get confused. I'm not sure if it's a patellar tendinitis I have, a patellar tendinopathy. My orthopedic physician said one thing, my physical therapist said another. And so at some points it really becomes less important, and it just becomes more of, what is the time frame we're into? But that's a really common question I get a lot in the clinic about what are all these words we're saying for this diagnosis, and are they really the same thing, or are we comparing apples to oranges kind of deal?
Exactly. And we treat them slightly different too. So when you have an acute injury like a itis, again, tendinitis, that's an inflammation of that tissue. Our goal there is to let's put the fire out before we do anything else to reinforce and strengthen things. So we'll do whatever it takes to, we restrict activities, we change the way you're riding, where you're riding, how much you're riding, educate about simple things like the use of ice. Ice is a phenomenal anti-inflammatory that I think sometimes we skip over way too fast and go jump to drugs.
Yeah.
Even things like ibuprofen and things like that, we can supplement their use with oftentimes ice. But again, certain other injuries like arthritis may not respond to icing nearly as well. They actually might get more aggravated by that. So we're here to kind of teach you that difference too. I know that that's a simple thing, but again, between itises and osises, there's a different approach to how we're going to implement the treatment for it.
Definitely. Thanks for bringing up ice, by the way, because I have seen so many patients now who have talked to me about how they feel like ice doesn't do anything, and it does so much for you. And it's so, so good to use ice on an injury. So those old adages that you've had your whole life of using heat or ice on an injured tissue can actually be helpful. And that's our job to tell you and really determine which one is going to be more appropriate for an injury and at a period of time too. So it is effective, it is useful a lot of the times clinically. So definitely keep that in your back pocket for the next time something is irritated. Cool. So a lot with our physical therapy sessions, we want to touch on what is the role of bike fit in a physical therapy session. So, or even just in the journey of your injury or dysfunction at a time. So bike fit is a great place to start. And I think it's just one way that you're going to tackle any injury as a cyclist is to make sure that the fit is correct. So we have a lot of great local shops. We're spoiled here in Eugene that offer some really skilled bike fits to assist in any injury you might have going on that's related to cycling. But Aleksey and I both think these injuries or these treatments shouldn't be isolated to bike fit alone. So you shouldn't just say, well, I did the bike fit and now I'm all good. I'm all better now. That can take away some of the pain or dysfunction, but you might have some weaknesses that can be lingering, and it could be good to take care of those. So that poor setup on a bike that you had before your bike fit can identify that area of weakness or that tissue susceptible to injury. This picture here is really cool. This is some of the angles that you're going to be looking at if someone's doing a bike fit for you. So Aleksey and I are really into what's called biomechanics, and biomechanics is really what it sounds like. It's just how people move and the mechanics of movement. So the way we take a look at that a lot is from images like these. We'll take a look at certain or specific anatomic markers on people and use those as areas of references to draw angles. And then that determines for us if someone's having more pressure, less pressure, using that joint appropriately or how we would like them to, or if they're a little bit tight in one spot, and that gives us a clue into we might address some issues there or add some stretches in, really.
Yeah, and just to kind of give you an idea, of how the bike fit really goes. So this is just one side picture. We try to gather data in a variety of different positions. So through different parts of the pedal stroke and in different positions on the handlebars. So most of us riding road bikes know the difference between the hoods, the drops, and the flats. As we move around in different positions, we can kind of help figure out, is there a way we can make that position most comfortable for you if that's the position you spend the most time in, or how can we find that happy medium that's going to let you ride in all those positions with as much comfort as possible. We all know that sitting in the drops, well, for most people, is not the most comfortable position for a long ride. What's best is actually moving around. But we look at ankle angles, knee angles, hip angles, how the spine is curved as we're riding, and not just in the low back, but we're actually differentiating it between the low back, the lumbar spine, the mid back, all the way up to the neck, the thoracic spine, and then the cervical spine, which is just the neck. And there's over 30 vertebrae there that we're basically trying to see, is one of these motions restricted for you, or is this just a poor ergonomic setup of you on that bike? We also look at the view from the front. So we set up a camera on the front and on the side. And from the front, I mentioned this earlier, we're looking at knee alignment with your ankle and your hip. When you're clipped in, your foot is fixed. You have a little bit of rotation in and out, but you don't have a whole lot of movement side to side or forward and back. So if your cleat is positioned too far in, that may be causing your knee to dive out a little bit. If your knee is positioned too far out, it may be causing the inverse effect of that. If you have an arthritic hip that is not letting you flex a normal motion like you should be, you may need a spacer for your pedals to actually space your pedals out a little bit wider. Or we take the other approach. Do we fit the bike to the person or the person to the bike? So as PTs, we can also do some sort of interventions to help that hip move the way it should. Right. And that's where Mike was saying the treatment shouldn't end at the bike fit alone. For our fits, if you schedule just a bike fit alone, we can do just that for you too. But we like to incorporate the whole person, not just the bike.
Yeah. And I think what's really cool about bike fit is it can change for the person as they change too. So if that person starts really inflexible and really needs things modified for them, but then say they build on their flexibility and then they have greater ranges of motion, now you can now change the bike fit to enhance their performance, for them to do better and just feel better on the bike too.
Absolutely. And for that matter too, if you're dealing with an injury, we can temporarily alter your bike fit to keep you riding until you get through that and then put you back to the position you were in. So for instance, we have some racers who kind of have a neck or back injury that we need to offload for a little bit. So we can work on how can we change this and then put you back to your race position afterwards too.
Absolutely.
So we put the slide up as basically just just to show that rehab and performance are kind of hand in hand. Mike and I are not bike trainers. We're not coaches. We're not going to be able to write a good training routine for you, but we're going to be looking at basically the same things, whether somebody comes through the doors and says, I have pain, or I am not as fast as my friends. We're going to be looking at modifying activities, whether you should be riding, you know, to the level you're riding, or you should be changing those things. You should be changing posture, position, habits in general, whatever that may be. We're always looking at core strength. Again, I can't emphasize this enough. If your hands are connecting you to the bike in the top and your feet are connecting you to the bike in the bottom, everything in the middle is lost energy if you don't have good strength, core strength. I worked in the bike industry for 8 years, and I watched things progress from steel to aluminum to carbon to lighter weight components that are always stiffer and stiffer and stiffer. And the answer and the thing that everybody in the bike industry was searching for was a rigid component. Well, when you're talking about performance, a rigid component, you want something that as you apply a force to it, it transmits that force to the ground. It gets you moving faster. It doesn't absorb that force through any sort of extraneous motion. But if your core is breaking down, you can have the lightest, stiffest, fastest bike of all your friends and still be slower.
Mm-hmm. That's true. You lose a lot of efficiency if you don't have core strength. So we see it a lot in any athlete, really, runners, cyclists, you name it. If you don't have core strength, you're just bleeding out efficiency at that point.
Yeah, there's a lot to be left on the table if we have a sloppy body and a really stiff bike.
Yeah, seriously.
No offense saying sloppy bodies to anybody who does.
Awesome. So really, this talk was just to offer for folks that we offer a variety of services, and it's not just bike fit, it's not just rehab, but it's a little bit of both. So the mechanics of your bike can be correct, but that biomechanics or how we move can be inefficient, just like how Aleksey was talking. So our goal is really to identify your weaknesses and make them your strengths. And just like Aleksey was saying a little bit earlier, it can be your body or your bike. So we're really the ones who can help you determine, like, do I need to change something for me, or do I need to change something for my bike too? And we don't just work exclusively on that too. We're in concert and talking with the mechanics at the bike shop too, to help you make that decision so that can be made well for you too. Our whole idea for this talk really just came out of the COVID-19 pandemic happening and people picking up their bikes and going out and riding, which really just inspired us that the community is just growing for cycling and the bike shops can't keep bikes on the shelves. So it's really awesome just to see that happening in the community. We want to keep people on their bike. We want people to be riding for a long time to stay happy and healthy. So this is one way for the community. We're just excited to talk about these things, let you know that we're a resource for you guys and that we're here available for you for questions, anything like that we can be helpful for. So.
Yeah, if you guys are unsure about whether bike fit is right for you or if it's something that we can help with, you guys are always welcome to shoot us an email. I don't know if our emails got provided with anything there, but we can make sure that they go out. So if you guys need to use that as a resource, we can always schedule an evaluation and just take a look and say, you know, is your pain arthritis, or is it because your bike, is it just because it's an arthritic joint, or is it because your bike has poor alignments? You know, we're happy to be the resource for you guys on that.
We've got a really great question from Karen. So why would one hand go numb but not the other if it has to do with shoulder stability? This is really good.
All right. So hand numbness can be caused by a lot of different things. So I think I, again, did a little bit of a overgeneralization by saying that shoulder stabilization. So hand numbness could be as an irritation of the nerve anywhere along its path. So if we have, for instance, the ulnar nerve, which is one of the most common areas for cyclists that have a lot of issues. So that nerve travels right underneath that fat pad that we have on the bottom of our hand. As we put our pressure onto our bike, if we're overpressing on that or positioning slightly inappropriately, we can cause some tingling in usually these last two fingers. This nerve travels even further up the elbow. So if we have a poor alignment of our elbow as we're riding, or we put a little bit too much stress and vibration through there, we can irritate that nerve somewhere through here. That nerve can be irritated in the armpit, which is where our brachial plexus is. So the group of nerves that is all over, that basically all come from the neck to innervate a variety of different movements and sensory components in the arm. Or that nerve can be irritated somewhere at the base of the spine, so at the nerve root. So when we do our assessment, we take a look and see, is it because of a scapular positioning and weak shoulder stabilizers, or is it because of some sort of nerve irritation somewhere along the path? And one side can be more irritated than another if there's truly compression here that's not happening there along anywhere on that path, or if it's an area that's had an injury before that may be a little bit more sensitized and susceptible. There could be a lot of different causes, and our puzzle is to figure that out, and that's what we enjoy.
Absolutely. And I think that's, Aleksey just mentioned so many great things in that answer to that question. And I think the best thing is that it can be multiple areas. And the longer and longer I treat as a clinician, it's not one area that's causing compression. It's usually two or more than that. And so checking each of those spots is actually very, very important for that ulnar neuropathy or that numbness and tingling, to make sure it's not happening at multiple areas along your body. For some people, it can happen as a buildup even throughout the day too. So if you maybe work an office job or you're on the computer a lot at home and you have some tension maybe on your right side that just builds up throughout the day from an improper sitting posture, and then you go hop on your bike, that can cause maybe one side over another as well too.
John, do you have a specific thing you'd like us to clarify?
Oh, we got a few here.
I just saw the what comment, and I just didn't know if there's anything in particular that Mike or I said that.
Unmute. Sorry, I'm trying to unmute. I was trying to type away here and I did the wrong thing. So I'll ask in audio.
I do that a lot. Do you want to ask your question?
So
audio?
what's the process for doing a fit? How long does it take? How much does it cost? Do you bring your bike in and set it up on a trainer? Do you have your own facility for multiple positions? Tell me more about that.
Yeah.
So the price again can be dictated by whether or not we're billing insurance. So if we're billing insurance, you would pay just whatever your normal physical therapy copay is if you've met your deductible. So insurance is typically match your medical insurance for going to the doctor or anything like that. So if you have, for instance, a $500 deductible, any visits that cost anything up to $500, you're going to pay cash until you've met that deductible for the year. And then after that, you just pay whatever your copay is. If we do just the bike fit alone, again, both of our clinics offer cash pay packages, and there's a lot of different things that we can do. Mike offers a package for, you get your fit and then recurrent sessions for, I think, what is it?
About $550.
$550.
Yeah.
And that covers how many visits for you?
It's four visits in total. Yeah.
So 4 visits in total. So that's the fit and then follow-ups on that. For our clinic, if you want just the bike fit alone, it's about $150, which is ironically what we were charging at the bicycle shop when I used to work there too. So
absolutely.
The time constraints, typically I'm able to get what I need done in about an hour. So I put somebody on that bike, and again, we look through a couple of things, we troubleshoot certain positions, and then I like to take a separate session to really check out the rest of the body too. So I like to spend time with tinkering on the bike and then spend time with tinkering on the body. In terms of our setup, we both have just basic Cyclops trainers in here, just like you would use for an indoor trainer for yourself, some blocks and everything. So all you need to do is bring your bike in. We'll set you up on that trainer. And like I said, we'll set up 2 cameras, or we just use an iPad. I get it from different angles, and we videotape. And that way me and you can talk about, here's what I see, here's why I see it, here's what we think is going to help with that, and how we can change the position. And then we try those things and we see how that affected those issues that you might be dealing with. And of course, go out for a few rides and give us some feedback. I communicate with a lot of my patients via email too. So, sometimes I'll say, go for 2 or 3 rides, email me and let me know, hey, that went great, or we need to do some more work. And that's where, again, we dive into, is it the bike or the body?
Absolutely.
Was there something else on that in that question?
We have actually a few more questions, but one thing I wanted to add in too, especially for our clinic, John, Cooperative Performance and Rehab, for our cash pay option, we're looking to roll that out here sometime in May, maybe June. So keep your ear to the floor for us, because we're going to be trying to release that in a little bit, and we'll have that open. So we'll give you our phone number and our website information too, so you can check on there and stay posted. And you're always welcome to just give our office a call and ask questions. We have a wonderful administrative team that's very aware of what we're doing clinically and can answer questions for you. And we'll also give you guys our email too, so any questions you have, we can answer too. Anything we didn't touch on that you'd like to know, John?
No, that covered the questions I asked, but I do have another one. So what are you doing about integrated cockpits? What happens in the case where you say, oh, you know, you need a shorter stem, that'll only cost you $600?
Absolutely, absolutely. So that's where the partnership with bike shops really comes in. So as physical therapists, we're not looking to sell parts. What we really do is we're going to tell you, hey, we want you to get this stem. What you can do is talk to your favorite bike shop. We can work with them and let them know that you're looking to get a bike fit with, or you have been getting a bike fit with us, and then you're looking to order a stem. And that helps the bike shops out too, because they know who you're talking to, you know, you're talking to a professional, and that they can get the stem in there for you as well. The goal is to get the stem right the first time, so you don't have to do a bunch of returns. And that's really what we're looking for.
Yeah, and Mike's clinic and my clinic are both within a very short proximity of 2 shops.
Yeah.
So that makes a total of 4 shops. And so we can definitely recommend you to either one of those shops, or if you guys have a preferred place, you know, you can always write down the general dimensions of the components that we need. So if we're talking about replacing a stem, you know, stems can range anywhere from $30 to $400, depending on the quality, the material, all those kinds of things that you want. So we'll leave it up to you in terms of what you want, but we'll give you the recommended dimensions that we think are going to work the best. And then you can address that at any shop. And I think that answers David's question about if we sell components or anything like that. We don't. We're purely a healthcare provider that can help you with guiding you into the right direction, but we don't sell any parts or components. I don't think your clinic does. You know, we sell things like foam rollers, tape, you know, those kinds of things at our clinic, but nothing that is bike specific.
We're not looking to steal anything from the bike shops at all. We want them to be the experts in the mechanical components of the bike. We're looking purely for the ergonomics of people cycling, keeping people healthy and happy on their bikes. We want them to really be in charge of all the mechanical issues of your bike. So
yeah, in an ideal world, we're just partnered with all the shops. I want to have a great relationships with the shops here, and I've gotten to meet some really, really nice people at some of the local shops.
Absolutely, yeah.
So, looks like we have a few more questions.
Yeah.
So Mel says, my hand, usually the right one, gets tingling in the fingers and thumb after sleeping about 5 hours. Getting up and walking around 5 minutes and squeezing the fingers usually makes it go away. What is this? Again, it's a really hard thing. I really wish that it was that simple for us to say, this is exactly what's going on. A lot of times when we sleep in different positions of our neck, we could be irritating that nerve there. So changing pillow positions or doing some sort of hands-on manual therapy that can improve mobility, so you're not over stressing one component or another. It could be just nerve tension. So sometimes these nerves along their long path have adhesions or hangups somewhere through it. So we can help with massaging the tissues around and breaking up some of that scar tissue, doing some guided nerve mobilization techniques, however that may be, to affect that particular nerve. The fact that it goes away pretty quickly is a really promising thing. So I wouldn't be terribly alarmed that you have something that is really bad, but it's hard to say anything conclusive without doing a full assessment. And I'm not just trying to get you guys in the door. I really wish I can give you guys some better advice, but it's never that simple.
Absolutely. One thing too is definitely, like Aleksey was talking about, definitely check out your sleeping position, because although some folks will fall asleep and be like, yeah, I'm in a good position, or You can always ask your spouse as well too, and how you wake up. And if you are heads tilted in a really weird way and in a strange position when you wake up, you can be compressing those nerves as you're sleeping as well. So always check on that stuff. And like we talked before, it can be some muscle tension that's building up too. So it can be good to take a look at that too.
Yeah.
Oh, this is a good question, Patrick. So can you recommend specific stretches for cyclists before and or after rides? So, man, I could offer a huge list just over the whole lower body.
Why don't we pick two each that we commonly use for a lot of our cyclists? And again, I don't know if I need to do a plug to say this is not medical advice here. So please don't hurt yourselves, guys. Our goal with this is, of course, just to give you a bit of an idea, if any of these stretches hurt things worse, seem to make your symptoms worse, please don't push it. Just come and see one of us. We'll help you get through it. Or even if you have another physical therapist that you already prefer, our goal is to not just promote ourselves, but promote our profession in general. Why don't we pick two stretches or exercises each that we find ourselves using with a lot of our cyclists.
Yeah.
You want to go first?
Absolutely. I'll just grab one. So you're going to use your quadriceps muscles a lot. So please stretch those because that is most commonly. Yeah, absolutely. If you want to pull up on me.
Can you guys, or hold on, we'll just use this one here.
Yeah.
How do I get out of the screen share? Stop share?
Yeah, absolutely.
All right.
Wonderful.
And then if we.
Yeah, they should be able to see that now. Good.
All right. Can you guys see Mike now?
Yeah, we'll talk about stretching our quadriceps muscle here. So that's the muscle on the front of our thigh. This is really good, especially for folks who are having some knee pain, to stretch this out. This muscle right on the front is called our rectus femoris. It's one of the quadriceps muscles, and it can provide a lot of compression to this knee joint here. So while you're doing this, it might feel a little bit uncomfortable, especially in the front of the thigh. Doing it standing is a nice one. You can hang on to your bike next to you for a little support if it's held up next to a wall. Pulling that leg back and holding here can be a great stretch to get ready. Holding for about 30 seconds is really good, and just going for about 3 times is good, so you can switch sides there. If you stand or sit for a long period of time at work, this is also a really good one to do right beforehand as well, especially if you're having any of those knee discomforts at all too. So
don't fall over, Karen.
Yeah, don't fall over doing this one. You can also do this one on your side if you have trouble balancing too. But at any rate, you can always hang on to something that's close by that's nice and stable too. Cool.
Yeah. So another thing, do we have a foam roller in here?
Yeah, actually that white one right there. Yeah.
So one thing that we find a lot is, like I mentioned earlier, some thoracic stiffness. So the thoracic spine is basically all of the spine between our neck and our low back. So where the ribs end and where the neck starts. So foam rollers become a really great tool to use as a fulcrum to be able to extend backwards over and use our body weights to help create some of that mobility, decrease some of that mobility restriction. So we'll put it down on the ground and
let's see if I can get
you see me all right? I think they can see me. Yep, perfect. So as we put the foam roller down on the ground, we try to put it somewhere wherever that restriction is. For me, if I'm not getting very specific, one day I might be tight in one spot, one day I might be tight in another spot. So I'll work on a number of areas and see what works best for me. But the goal is that we don't have the hips in the air. We have our butt on the ground. We have our hands behind our neck because we're not looking to get a lot of cervical extension. Most of us are really mobile in that direction, not very mobile in the direction of extension in that mid back. Another mistake that people always make is they hinge through their lower back and forth, and they end up just rolling that foam roller over and over. So we pick a spot on that thoracic spine, tighten up our core to make sure that it's not the low back that's moving back and forth, and sliding forth right there. Translate motion, not everything above and below that. I teach this one a lot, and I find myself coming back to it time and time again because people have a hard time isolating that motion. Spine helps decrease the stress and strain on the neck, and potentially some nerve irritation that starts to go down the arms. I think we promised them 2 each.
Oh.
Oh man. So my hamstrings are extremely tight right now, but a simple hamstring stretch is really often underutilized. Hamstrings, when we're sitting on the bike, are in a very flexed position. And there's a million and one ways to stretch out your hamstrings. You're going to have to find whatever is going to be best for you. It could be as simple as doing a chair stretch. So if we just place that there, Mike, would you mind tipping it forward just a little bit? You can kind of see my reflection on there. So as we put our leg on the chair, we've flexed that hip a little bit. We've straightened out the knee, putting the hamstring, this muscle right in the back of the thigh, on a lot of stretch there. I can get sloppy with this and just round my back and really not get much of a hamstring stretch at all. Or I can get up here, I can tighten up my core, I can tilt my pelvis forward. And now it doesn't take very far for me to move before I start to feel a ton of tension all the way through all of this. Knee pain, hip pain, or even sometimes sciatic issues too.
Absolutely. You might have to be my cameraman for this next one.
Mike's got one more for you guys.
I got one more. So this one's a great one. So folks who are having some low back issues, sometimes it can be tightness in our glutes that's causing a lot of compression back here because they attach right up next to our hips here. So it can cause some compression in this area. So one really good stretch to do for your glutes, and especially those who are more athletic too, what you can do is, if you imagine me having a strap or a rope around my leg here, coming up almost for a hamstring stretch here, like Aleksey was doing, and then bringing my leg across, I can now stretch my gluteus maximus back here, and I can get a nice stretch through there. Again, holding for about 30 seconds can be really good, especially when you're using that strap to hold out and across, and you can get a really nice stretch there. That can feel great and help you maximize some power while you're riding as well.
All right. So hopefully that gives you guys a little bit of a teaser, a taster. Again, we didn't coordinate this green on green.
Yeah.
This is just a coincidence.
Yeah, we're just that good.
So Randy, I'll make sure that we give our contact information to all the folks over at Gears. If you guys could send that out, that'd be great. I really appreciate it. And I don't know if our PowerPoint was made available to people too, but in there we made we put both of our websites on there. The company I work for, so Mike's clinic is, it'll be an easy access to their site. Our site becomes a little convoluted because Therapeutic Associates is a chain of clinics that is all through Washington, Oregon, California, Idaho. So if you're looking to find our website specifically, it's Therapeutic Associates Downtown Eugene. But we'll put our emails, we'll send our emails over to Karen. And the phone numbers to our clinics too.
Absolutely. One plug I wanted to put is that we can do screenings at our clinic. So if you're just not sure if physical therapy is going to be right for you and you need to talk to someone about it, they're complimentary. So you can sign up for one, just call our front desk at Cooperative Performance and Rehabilitation, and they can set you up for a free screen, and we can just sit down and talk with a physical therapist and to determine if physical therapy is going to be right for you for whatever you're dealing with at the time. If it's not, then we're going to point you to who we think you should go see, actually. So yeah, we'll give you information on how to get to that a little bit later. But at this point, we just want to say thank you so much to Gears for having us. We're so excited to be here and happy to connect with the community and just talk about our love for cycling and physical therapy with you guys. And we really just want to plug physical therapy for the community because it's something that's just going to help you improve the quality of your life through all of your years. So Aleksey and I really believe that too. So physical therapy is a really great thing and can really help you too.
Yeah.
Thanks so much, Mike and Aleksey. Really appreciate it. Just the foam roller and stretching lessons alone were, I mean, I had a million more questions and really informative and highly appreciated. Just a quick note to the crew too. Remember, 5/23 is our next education clinic. It's a women's climbing clinic here in Eugene. And again, we're going to be distributing the contact information from Aleksey and Mike. Deeply appreciated, super informative. Thanks again.
Thanks,
No
guys.
problem. Yeah, happy to do it.
Take care.